everyone, welcome to our channel Physiology, and here in this channel we have kept all the videos of practical physiology. Me and Dr. Sheetal, we are running this channel and we have various videos on practical physiology, and now we have also started placing some of the MCQs which were asked in previous year NEET question papers. Okay, so today we'll discuss few of the MCQs. Please try to give answer of those MCQs which were asked in NEET previous years. Okay, today's topic, that is nerve fiber classification. Okay, so let us start with the first one. This question was asked in AIMS May 2008. Okay, so which of the following is correct order of susceptibility of different types of nerve fibers to local anesthetic? Okay, so here B, C, A, B is greater than than A, then A is greater than B is greater than C is greater than A is greater than B, and C is greater than B is greater than A. Can you give me the answer? Okay, let me explain you here. We can make a table here. Susceptibility to hypoxia, okay, pressure and local anesthetic. Okay, and we can make here most susceptible fiber, intermediate susceptible fibers, and least susceptible fibers. Okay, so here if we put hypoxia, most susceptible fibers are our B fibers. Okay, intermediate susceptible fibers are A and least are C. So you can remember B, A, C. Same thing you can keep it here, B, A and C. Hypoxia, pressure, local anesthesia. Okay, so most susceptible to hypoxia is B, intermediate is A, and least is C. Next, here what we can put is, here in case of pressure, we can put, here, we are putting B and B for pressure and local anesthesia. Fine. And remaining, suppose if here is A, B, what is left? Here B and B, this one. So here what is left is B and B here. So what is left here is A, B and C. Okay, fine. Thank you, Aditya Kumar. And here local anesthesia, if we are talking, is C, B, which is left is A. Okay, so this way we can make a table. Fine. So here, what is the question now? So whenever you have your question, you make this kind of table. Okay, now what is your question? Which of the following is correct order of susceptibility of different type of nerve fiber to local anesthetic? So this one is asked. So your answer would be local anesthetic agent. That is, your answer would be C is greater than B is greater than A. Okay, so your answer is option D. If you are knowing the answer, please write down the answer in the chat box also. Okay, fine. So this is your correct option. Am I clear? Now we are moving to other next one. Here, afferent fibers most sensitive to local anesthesia. Again, the question is coming in a different way. This was also asked in AIMS May 2004. Good, Aditya, correct option. So here again our table we have to make the same way, just we are revising it. Hypoxia, pressure and local anesthetic. Most susceptible, intermediate, least. Okay, you have to make the table. Here B, A, C. Again B, A, C. Then you put B, B here. Okay. Remaining one you have to write down A, B and C, C, B and A. Now what is your question? Now read the question. Afferent fibers most sensitive to local anesthesia. That is your C fibers. C fibers are for pain, and this is the reason, because C fibers are most susceptible to anesthesia. We are giving anesthesia to decrease the sensitivity of local anesthetic. Okay, option C. Very good. The option is C. Aditya, correct option. So this is the reason, to suppress the pain we are giving local anesthetic, because pain fibers are highly sensitive to local anesthetic agents. Fine. Next question. A patient slept by keeping his arm by side, and when he woke up, he felt tingling and numbness sensation. Which of the following sensations are affected? Sorry, I just left putting this animation, so you might have all this. Sorry, but I will explain you. The thing is, whenever, so here A fibers is the correct option. Now, what is the explanation for this? Suppose whenever we are giving pressure, okay, pressure again we have to make it, we have to make a table: hypoxia, pressure, and local anesthetic. Okay, most susceptible, intermediate, least susceptible. B, A, C, B, A, C. Again B, B. Here would be C, because what is left here you can see here A, B, and C. Then C, B, and A. So which fibers are susceptible to pressure? Because the person is sleeping by keeping his arm by side, what happens? There is a pressure given on the arm. So when pressure is given, okay, but you explained as early. Sorry, but sorry is that because of lack of animation, you could get the answer first. But this is the explanation. Fine. Fourth one. A man in outer space is left stranded in the space capsule, and the oxygen level is kept on decreasing in the capsule. So now what happens? Oxygen of that patient decreases. Okay. Which of the following sensory information is affected least? Okay. Oxygen means hypoxia. We are supposed to think about the hypoxia. Again, we have to start with hypoxia. Then next is pressure and local anesthetic. Okay. Then hypoxia most susceptible, intermediate, and least. Here B, A, C, B, A, and C. So which is the option C? Because what is the question? Least affected. C fibers, they are for pain. So what would be your option? Correct option, you can say that is C option, because so when the oxygen concentration decreases, that results in hypoxia, and hypoxia least sensitive fibers are pain fibers. Okay. So correct answer is D, pain fibers. Okay, fine. Then next one is velocity of conduction of action potential in myelinated nerve fiber. Okay, if suppose we have a myelinated nerve fiber and the diameter of the fiber is 12 micrometer, what is the velocity of conduction of action potential? So now conduction velocity. Here there is a rule. If we want to calculate now conduction velocity, velocity of conduction, okay, that is equal to diameter. This is a formula you have to remember: diameter multiplied by, okay Aditya, got it, fine, diameter multiplied by 6. This is a formula. Okay, so in that Erlanger gases classification also you can easily find out, if you have the diameter you can easily find out the conduction velocity. So this is the formula for calculation of velocity of conduction. But very important thing here, this formula is only for myelinated nerve fiber, not for unmyelinated. Okay, this is given in the book. So for myelinated nerve fiber, how can you calculate conduction velocity if the diameter is given? What would be here? So diameter is 12 micrometers. So 12 multiplied by 6. This would be 72 meters per second. Okay. So this is our uh, conduction velocity. So here we are ending our today's session. I'll come up with more other MCQs in my next session. Thank you so much. Thanks for being with me. If you have not subscribed our channel till date, please do subscribe it. Like my video, share it with all your friends. I'm making small videos, short videos, and I'll try to explain or try to cover all the topics with all the topics MCQs that are commonly asked in your NEET teaching. Thank you.